upper tract urothelial cancers are kind of rare cancers, a rare disease. It accounts for 5 to 10% of urothelial cancers. I think the US, it's predicted to have sort of 6,000 cases a year. And this kind of a difficult disease sometimes for diagnosis as well. So most of the times you're diagnosed not most of the time, but sometimes you're diagnosed the disease in the later stage, because it's oligosymptomatic and you have hematuria or pain. That's our main symptoms. And for imaging standpoint, it's kind of difficult as well to make a correct diagnosis. So on the other hand, the treatment, the standard treatment for most of cases is the removal of the kidney and ureter. And this is very important because we know already that people that has undergone nephrectomies, they are prone to cardiac disease. And even in this case, some patients are going to need, for this disease upper tract, some patients will need chemotherapy. And the renal function, impaired renal function, sometimes these guys are not allowed to get the good, let's say the standard chemo because of renal function. So it's paramount for those guys to remain with the good renal function, and sparing the kidney is very important. So in this way, because how the technology works, because it just needs a light, it's based on light. So you have a natural path through the urinary system. So these tumors are located in the ureter or the renal calyx or pelvis. That's the inner part of the kidney that are responsible for the urinary drainage. So you have a natural pathway that's the same one that's used for treat kidney stones and other things. And this is a net need. It allows us to, this natural path allows us to reach the tumor easily, even if inside the body, the kidney, you can easily reach the tumor, and it's easy to apply the light source. So this is a minimally invasive treatment. You have endoscopic treatment for upper tract. It's made by laser heating, but the recurrence rates are high for endoscopic management. So what we did, this is a phase 1. So we presented the first results for the phase 1. We treated 16 patients, and we presented the results for the first 14. And this is a dose finding study, but we look for the results and the outcome, the oncological outcome of these patients. So these patients receive the padeliporfin in the vein, in circulation. 10 minutes later, they start receiving light. It's just the light that is activated. And it's a fast procedure, and they're going to discharge. They can go home after recovery. And what we found is that, and the patients are allowed to receive up to 2 treatments after 30 days in interval. And what we found that after the first treatment, we have 64% complete response. That's very nice. And for the other patients after the second one, we have another 67% complete response. So we end up with a good oncological outcomes and a follow-up of 11.5 months. So we consider that a very encouraging results, and mostly for the lesions that are smaller than 2 centimeters, we have 75% complete response after the first treatment and 100% after the second treatment. And this is worth mentioning because this threshold, the size threshold, are the size that the NCCN guidelines and the European Urology Association guidelines have for the endoscopic treatment. So endoscopic treatment should be low-risk patients with tumors up to 1.5 centimeters by the NCCN and 2 centimeters by the European Urology. So I think these are good results, and the renal preservation was very good. So there's just minimal fluctuations on the renal function during the follow-up, and just one patient lost the kidney. And it is not, but this patient has a complete response, but they have recurrence in the bladder, high grade recurrence in the bladder, and the kidney as well, so the pelvis as well. So we decided to remove the kidney. So I think the results are good, and the renal preservation, toxicological results are good. The renal preservation was good, and with minimal side effects, minimal adverse events that are not going to, I'm not allowed to talk about this because they're going to the matter for the publication that's coming, and need to FDA approval for that.